First it was the army, now it's the fire brigade, drafted in to distribute personal protective equipment, PPE, across London to health and social care workers. But distributing it is one thing, sourcing it is an entirely different matter. Channel 4 News has spoken to a number of distributors and manufacturers who have made offers to the government, repeated offers, only to hear nothing back.
When I called the government office, I had initially access to 3 million masks. By the time I filled in the form, which was a few hours later, I was offered 10 million masks for supply and delivery ex-China on the Tuesday, Wednesday, the following week. I then only had an email later on the 31st of March confirming that I had in fact filled in the form. And then I had a further email on the 2nd of April, by which time the delivery date had already passed and the masks had gone, that I should provide further details, i.e. CE certification, for example. But I had already entered the CE certification number on the form when I filled it in.
So now you can see, now we have so many stock.
And here are boxes containing 100,000 PPE protective suits shipped from Italy to Shanghai and waiting to be sent here. Except the UK has not yet taken up this offer. These suits are capable of dealing with viral, biological and radioactive contamination.
It's been close to 3 weeks since we have been in interaction. So though there has not been much response to the online submission, but to phone calls to the procurement offices, there's been response. So though it's not as fast as we could imagine given the emergency, but I would say that things are moving ahead.
Today, the government said it was rapidly going through 8,000 offers from suppliers and ensuring that they meet the quality and safety standards, as well as prioritising those with larger volumes. They have also appointed the former London Olympics chief, Lord Dayton, to boost production. Yet a promised flight from Turkey with PPE has caused further embarrassment, as apparent problems with the paperwork meant it had still not arrived by this evening. We asked the Health Secretary today about clearing away some of these obstacles faced by local suppliers and manufacturers.
We're always trying to improve the processes that we have in place to make purchases. I think it's been very encouraging, the number of UK companies that have come forward, but we have had to make sure that we sort out the credible offers from those that are not.
The protection of health and care workers has now become a pressing issue in this pandemic. With the growing number of deaths of frontline staff and delays in providing PPE and testing, the spotlight is on what could have been done or what should have been done to avoid this. The latest figures released by the Office for National Statistics show a significant increase on the daily toll announced by the government because they include care homes and deaths in the community. So on April the 10th, we were told just over 9,000 people had died. In fact, it was significantly higher, 13,121. And crucially, care home deaths were 1,043 to April the 10th, up from just over 200 the week before.
We do need more help with obviously PPE, getting those supplies to the front line. Testing is the key thing for us because today, as I speak, we still haven't been invited to do any testing and we need that for staff and for clients. So those are two areas now. Later on, we need some financial support because social care was always in difficulty before. And I think as the longer this goes on, the more help we need to government so that we can survive. That's the key issue for us.
The government is just 10 days away from its promise to test 100,000 people a day, although it currently only has the capacity for 40,000, with just half of those being taken up. Yet they remain somehow confident that they will reach that goal.
Well, joining me now is Anita Astle. She runs the Wren Hall Care Home in Nottinghamshire, where a number of her residents have passed away from the coronavirus in the last couple of weeks. Anita Astle, thank you so much for talking to us today. We're only really beginning to understand how devastating this has been for care homes. What do you think about today's figures?
I mean, the figures is one thing, but for me, it's about the people. You know, every figure is a person. And every person is a loss to their family and to the care staff that really care about them. So my heart goes out to the individuals that have lost their lives and to their families and to the care staff that I'm sure love them very dearly.
I mean, in your own care home, we spoke to you a week ago. You'd already lost 9 residents. You always regard them as your family, and you've since lost another 4. I mean, what toll is that taking on you and all of your staff?
I think I said last week that we felt raw, we feel broken. It's a huge toll, but at the same time, there's other people in our home that are living well, and we've got to continue to support them, to protect them, to keep them safe from this virus. And that's where our focus is, as well as supporting those that have the virus and their families.
Last week, you were spending a significant amount of your own time trying to source protective equipment. Has that improved at all?
No, every day. I mean, we're using copious amounts of this equipment, unprecedented amounts. And so we are counting the amount of stock that we have each morning. We're counting it before we leave at night. Just so that we're keeping our finger on it, so that we are sourcing equipment. Sadly, we're having to rely on the local public to help us, local businesses, but we're fortunate that they are there for us and they are helping us in this battle.
There often seems to be a disconnect between what we hear at the daily briefings from the government about supply of PPE and what is happening on the ground in care homes like yours. I wonder what you feel about being left to rely on local businesses to provide what is life-saving equipment for your staff.
It's life-protective equipment for our staff. It shouldn't be that we're relying on local businesses, but without them and local people, without them, we just wouldn't have the equipment that we need. So we're extremely grateful for the support that they're giving us. And we're just urging the government to source the equipment so that we can have it available as and when we need it.
Well, Anita Astle, we're extremely grateful for you talking to us today, so thank you very much.
Thank you.
Well, Victoria MacDonald is here now, and we've just had some other sad news from another care home.
Yes, I really apologise because, as Anita said, behind each number is a real person, and I'm afraid I am coming back to some numbers, but HC1, and they have 300 care homes across the UK, have just announced that 498 of their residents have sadly passed away from COVID-19 or suspected COVID-19, and they've had more than 3,000 cases, which is really upsetting for the staff. I just can't even imagine it. It sort of shines a light, too, on what's happening in care homes and in the community again. And some of these ONS figures that we were talking about earlier show that there is an excess mortality rate in which COVID-19 isn't stated, thousands, in fact, which really comes back to this issue that we've talked about quite a lot recently on Channel 4 about what's going on those death certificates, but also a concern that maybe people aren't going to hospitals or are choosing to die at home.
And there's been an announcement just recently on vaccine trials.
Yes, this is me being less gloomy now because there is some good news on vaccines. The Health Secretary announced today that there are trials at Imperial and Oxford, which we know, and he has promised that there will be everything done to ramp up production if they're successful. But I will let the next guest explain more.
Victoria MacDonald, thanks very much for coming in. Thank you.
Thanks, Jackie. Well, I'm joined now from Oxford by Professor Andrew Pollard. He's the head of the Oxford Vaccine Group, who'll be carrying out those trials on humans on Thursday. Good afternoon, good evening to you, Professor Pollard. I guess congratulations of sorts are in order?
Yeah, good evening. Yes, I mean, we've had a huge amount of work to do to get to this point, but of course this is just the start, so perhaps not congratulations yet.
OK, well, yeah, let's not preempt that. Let's not jinx it. How long will these trials now take? And when do you think you'll have the first vaccine available for use?
Well, the trials have to be undertaken very carefully to, first of all, ensure that the vaccine is completely safe, but then also to test whether the vaccine can protect people against this coronavirus, the pandemic virus. And to do that, we divide our vaccinees into a group who get the new vaccine that we hope will prevent the disease, and another group who have a control vaccine that doesn't have any effect against coronavirus. What we'll then do is see how many cases of COVID-19 occur in those two groups over the weeks ahead. And of course, we don't know at this moment how quickly those numbers of cases will accrue. And so I can't give you an exact time about when we'll have the results of the trials.
Right. I mean, I remember doing interviews with vaccinologists a few months ago, and they said, this is record time that we're doing all this, but we still won't be able to have a vaccine available for the mass market by the earliest beginning of next year. Is that still the case? Well, it really depends how things go in the trials. If there's a lot of transmission in the community and we're able to demonstrate that the vaccine works early, then it's certainly possible to get to a point where we have confidence that the vaccine can prevent disease. There's then a second hurdle that's required, which is to upscale the manufacturing to a point where you can make millions of doses and perhaps even hundreds of millions of doses. And that's an enormous technical challenge from where we are today. But that work is going on behind the scenes to try to get to that point. And it's certainly possible to be in the millions of doses in the autumn, but to the scale that's needed actually to control a global pandemic is going to take much longer than that. I was going to raise the issue of manufacturing next, actually, because we've been very good in this country at having really fantastic scientific ideas. We've not always been that good when it comes to testing or tracing or PPE kit, for that matter, of implementing those ideas. Now, do we have the capacity at home in Britain to produce the millions of doses of vaccine that will be needed?
So there isn't a single manufacturing facility that can do the tens of millions of doses that could be needed for the UK population. But there are a number of manufacturing organisations in the UK that together could provide some of that capacity. But it's clear that for the sort of supply that's needed beyond our domestic market, it needs much more capacity than is available in the UK.
But are we now lining up these manufacturers? Are we getting them ready so that if we have a successful candidate after all the tests, they're ready to go? Because that's been missing in the past from a number of other issues.
Yes, I mean, I think that's one of the great things about the government task force on vaccines, which was announced a week ago, is there's a whole team looking at how we can be in a good position for this. If there is an effective vaccine in the months ahead, that we have generated all the pipeline that's needed to make sure there's manufacturing capacity. But that's still a big technical hurdle, even when you have all of the pipeline there. And it isn't just making the vaccine, it's also having the ability to put that vaccine into vials that can then be distributed to those clinics where they're being used.
Indeed. Professor Pollard, good luck. Thanks very much. Speak again soon. Jackie.
Thank you.